Aloha, I'm Brickwood Galutaria. Welcome to Kupuna Power, a show for and about seniors. As always, we display the senior helpline phone number, 768-7700. Today, we discuss what it means for kupuna to age gracefully and independently at home. Utilizing technology is the key. Whether it's a scooter, a hearing aid, or a scanner that reads mail, technology can make a difference in terms of maintaining independence. However, some of these tools are not cheap. Kupuna ought to test them out first to see if they suit their needs, and once they decide, financial aid should be made available. Here to inform us on how technology can be used by our kupuna and, more importantly, how these tools can be tested out and paid for. Now that's important. My dear friend is here, Barbara Fishlowitz-Leong, who is the Executive Director of the Assistive Technology Resource Centers of Hawaii, let's say ATRC. Okay, so Barb, welcome to Kupuna Power. Happy to have you with us.
Thank you. Pleasure to be here.
Okay, let's begin with ATRC's mission. What is it?
ATRC's whole purpose is to provide information, education, and training about technology so people can remain independent, do things on their own, not have to depend on family.
What kind of technologies are we talking about?
We are talking about something as simple as large print books for people to read. We're talking about scooters. We're talking about communication devices. We're talking about hearing aids. We're talking about phone systems to amplify. So a wide variety of technology.
How long have you been doing this work?
23 years.
23 years, and every year I suppose the technologies get much better.
When we started, we had very simple technology. We had items how you could turn on your stove. Now, you know, we're teaching people and we're teaching kupuna how to use their smartphones. We're teaching them how to use computers. We're teaching them how to use technology again so that they can remain on their own.
You know, the last time we had a gentleman from Hawaiian Telecom, Bo Monday, who talked to us about internet scamming, because you're trying to get more kupuna to utilize computers, and then he's trying to keep them safe from people who are predators in that environment.
Correct, and we have a lot of kupuna come by the office. They want to look at technology. The thing that's different about our program, because it's federally and state funded, is that we're not a store. People are disappointed when they come and they see the technology, but our purpose is for people to make an informed choice and not be scammed by a salesperson who convinces them that this is the type of technology you need.
Oh, that's another type of scamming.
Yeah, so yes, because people are anxious, you know, they want their grandfather to hear, they want Tutu to hear, so they just go to the store and buy something. Then 6 weeks later they come to our office, help, it doesn't work. So this is why the federal government decided about 25 years ago that there would be technology for people to try before they made a purchase.
Okay, so this is a federal mandate.
Yes, it's a federal program.
The community itself, you know, aside from exclusively kupuna, also ranges to the youth. I would suppose. You know, one of my children, Sean, and you've met Sean over the years. He's 39 years old, by the way. Now, you know, having Down syndrome, he's accessed certain technologies too.
That's correct, and we knew Sean early on, and the technology has increased. So not only do we serve kupuna, we also serve persons with disabilities. We do a lot of work with the Department of Education, do a lot of work with Department of Health, making sure that everybody in our community has access to technology. Because we want people to remain independent, we want them to remain in their own home.
And that, you know, Barbara, that has been a big issue with regard to the aging population, is being able to stay home, being able to the term is aging in place.
Yes, very popular term right now, but that's what we want to see.
Yeah.
People really don't want to go into nursing homes. They really want to be with their family, or they want to remain independent. So variety of technology for hearing, for vision, for mobility, also for mental skills.
What kind of, well, let's stop at mobility as an example. What do you mean?
Well, for example, we can go into someone's home and make recommendations as to how they can make their home safer. And again, at the same time, we're not coming in to sell products. So mobility in terms of what kind of equipment you would need to still use your own kitchen. I mean, we can talk about a scooter for somebody to get around on the outside, but there's also devices that can help the person stay in the home. So specific types of ladders, specific types of reachers to get canned goods off the shelf, those kinds of things. Preventing falls in the bathroom. There's a lot of programs going on regarding fall prevention. But again, we can show you the kind of technology that would prevent those things from happening.
Okay, so that's inside the home. What about outside the home?
Outside the home, we're talking about scooters so that people can get around. We also help people look at, I mean, we're not a doctor in terms of canes or ambulatory kinds of things, but we also will show people a variety of walkers that they might choose, scooters that they might use.
You folks are open what days of the week, or what? How do we access your services?
We're open regular office hours 8 to 4:30. It's useful if you call, then we set up a demonstration that's specific for you.
Really? Where are you located?
200 North Vineyard Boulevard, Vineyard and A'ala.
Oh, that's the Aloha United Way?
Correct, correct, yeah.
Right by
Foster Garden, yeah.
Yeah.
Yeah, so it's easy to come in. We have staff that's specifically trained to sit down. So if it's a vision problem, we have staff that's trained to work with that technology. If it's hearing, then we'll work with you on how can you hear your phone? How can you hear your doorbell?
Oh, yeah.
Children are worried because they can't get a hold of their parents. So we'll sit down and work. Sometimes it's parents who come in with their children. Oftentimes it's the grown-up child now coming in with the Kupuna who's frustrated, and then they'll go, oh, and then the Kupuna's happy because now they can do it on their own and they don't have to feel dependent on the daughter or the son. And they feel good about that when they can do it on their own.
You know, you've always been a champion for the disabled. I got to tell you, I've watched you over the years. I've known you over the years, Barbara, and you're still 100% in this. Awesome.
I love it because technology now is amazing. And with your own son, I think you've probably seen advances in communication and advances in learning that are there. But it now comes down with your Kupuna Power program. It now comes down to those of us who are moving into that aging.
Yes, and we all are moving closer. What's important about Kupuna Power, too, is the ability to talk not only to Kupuna, but to those who will be Kupuna soon, and even those younger ones, too. The Kupuna, the Makua, and the Mo'opuna, because everybody's in the canoe together.
Absolutely,
you know,
absolutely.
And if we could be in the canoe together with the greatest of technologies, even better.
Well, we're looking forward to technology for individual use, but we're also looking for the development of medical technology so that people can stay in their home to get medical services rather than having to run around. So there's a whole new field out there.
Okay, great. And we can access that new field through Assistive Technology Resource Centers of Hawaii.
Correct.
It's located at 200
North Vineyard.
North Vineyard. Head on down there, or just look. Do you have a website?
Yeah, we have a website, www.atrc.org.
Okay.
And
phone number?
Phone number is 808-532-7110.
Okay, we'll get that on the screen too.
Yes, of course.
Okay. Anything in closing you'd like to add, Barbara?
What I'd like to add is don't be afraid of technology. Come down. Try it out. You can borrow it. This is one of the most amazing things about that program. You can borrow our technology for up to 6 weeks to see if that's the right technology for you. Okay.
Well, my dear friend Barbara Fishlowitz-Leong, I did it perfect this time, has joined us for the past few minutes. And, continue your conversation with her and with us. And thank you for joining us. It's technology here at Kupuna Power. Waialae, Kailua, Royal Sunset, and Kapi'olani were all names of what?
So SHIP is an acronym for State Health Insurance Assistance Program, which is a federal program under the Centers for Medicare and Medicaid Services. And then SagePLUS, SAGE stands for a wiser person, and PLUS stands for people learning and understanding the system. And when we were talking about the system, we were talking about healthcare, because the Medicare system can be challenging. Well, the Hawaii SHIP SagePLUS program, there's a variety of ways that folks can contact us. We have a toll-free number statewide and actually nationwide. So we get calls all the time from children on the mainland. They can actually call and make an appointment with the Executive Office on Aging where we're located for an appointment, for a face-to-face appointment. We're at health fairs, so we're always available there. We do outreach at the Social Security offices in Hilo, Kona, and the two on Oahu. So people can come into those offices on certain days of the month. And all those dates are on our website, which is www.hawaiiship.org. The program is a volunteer-based program, and so our volunteers are trained to help people with issues, any issues about either they don't understand their Medicare benefits, they're not sure, sometimes benefits have been denied, which is really common when it comes to ambulance services, and so we help them write appeals. We do long-term care financing, long-term care insurance financing counseling, where we can kind of give them an idea. If you're looking at long-term care insurance, these are the things to look for, these are the questions to ask. So we help them navigate that way. If people are looking at changing their health or drug plan, we can help them compare all the plans that are available. They could go to one of the health plans, but the health plans like HMSA and Kaiser can only talk about their plan, where the SHIPs, because we're unbiased, we can talk about all the products that are available in Hawaii. So we just kind of help it, make it a little bit easier to get the answers that they need. The most common things are people needing a drug plan. And in Hawaii, we have about 25 options. Well, actually, there's more than 25. And so we help them kind of narrow down the options so that they can make the best choice for themselves. And looking at what drugs are covered, what pharmacies to use. Other common things are, again, those ambulance denials, and we help them do the appeals. If they've been in a nursing home, and Medicare has said they're not going to pay because they may not have met the qualifications for Medicare to pay. So we help navigate through those different types of things. We're incredibly lucky because we've got a lot of volunteers that have been with the program since it began in 1992. And many volunteers will come where they've called into the program and they've had a question and we've helped them resolve it, and they've wanted to give back to their community and they've become a volunteer. So we get them a wide variety of ways. We're always looking for volunteers. And we don't just have one volunteer role, we have several different volunteer roles. So if a person's not comfortable counseling people, then we do health fairs, we do, again, outreach at the Social Security office. We have volunteers that come in and actually assist us in the office. We have our customer service volunteers that answer the phone and take down all the data that's required for the federal program. So they come through us through a variety of ways. The training is initially, it's about a 32-hour training. And we break it down into different modules. We have about 15 different modules. And so we go at their speed. We used to do it all at once, and it was just information overload. And then after they've gone through these trainings, we actually like them to work at the hotline, be that customer service, take down that information, because they start to hear those questions. And it becomes not as scary. Because a lot of times that's the biggest thing, is people are scared. What if somebody asks me a question that I don't know the answer to? And none of us know the answer to everything, and so we always tell them, we'll do research. Then after they've gone through this training, and we have meetings monthly, at least monthly, with each of the islands. And after they go through these meetings, then we hook them up with another volunteer that's already certified. And so then they'll help them, they'll be kind of their mentor. And then once they're more comfortable, we're doing testing all along the way to make sure that they're following our protocols. And then once they've completed the mentoring and done all the training classes, they're not certified until after they've actually done X amount of client cases with us. And then after that, they do recertification every year. The first step is to call our hotline. It's available statewide and throughout the nation, and that number is 1-888-875-9229. We don't need any personal information. We don't need their Medicare number or their Social Security number, because the phones are not secure, so we don't want them to leave. But what we really need is we need them to leave their name, their phone number, their zip code, and just a short thing of what their issue is. So whether it's, I need a drug plan, I've had a bill that's been denied, because that way we can get them to the right counselor in their area. So at that point, the certified counselor will take over, and they'll call the person back, and they'll get into the real specifics of the issue, and then they'll help them hopefully resolve it. Sometimes things can't be resolved, but 99% of the time it can be resolved. And then if they need a face-to-face meeting, the counselor will set that up either at the office or out in the community. We meet at the library, we've met at McDonald's, Starbucks, different places, so that it's convenient for them. This time is kind of the slower time, and we probably get about 40 calls a day. In the fall, when it's the annual enrollment period where they can change plans is October 15th to December 7th. That time we can get over 100 calls a day, depending on what's happening out in the community. And our guideline is that we return those calls within 3 working days. Sometimes it takes longer because we play phone tag a lot. They try and call them 3 times. On that 3rd call, they'll leave them a message and say, call the hotline back and let us know when some good times are going to be to call you. The system is very challenging. We're not allowed to say confusing. It's very challenging. And but part of it is we as individuals have to be active in our health plan. So we can't just assume that, okay, I'm going to sign up for this plan and everything will just work out. Is we really have to understand how each of the plans work so that we can make it work the best for us. Because we have plans that are HMOs, health maintenance organizations. They all have different kind of guidelines. And so people just have to really understand how their plan works and not be afraid to ask questions. And ask the questions before they do something, not after. Probably the most basic question is they call all the time and they'll say, does Medicare cover this? And then we have to we always tell the volunteers that it's a puzzle. And we have to get all the pieces of the puzzle so that we can put it together to find out what the actual question really is. And so, asking those things like, do you have a Medicare health plan? Do you have a retirement plan? Because those will all affect how Medicare pays for things. We used to say, start doing your homework 3 months before you're 65, because one of the things is that Medicare still begins at 65 years old, where your full retirement age might be 66 or 67. So 65 is still the magical age for Medicare in most cases. So we tell folks about 6 months before they're eligible is they can call us and we can give them some questions to ask. Because it will depend on if they're no longer working, if they're still working. There's so many different factors. But to start 6 months before they're eligible, start asking those questions, and then start looking at what's available in Hawaii. And the plans change every year. Every fall they change. So that's Medicare's way of keeping everybody young, because you just have to do all this homework still. And so we don't, it will depend on what time of year they're going to be 65. What's really nice is with our Medicare health plans, and we have 7 of them, which it's Aloha Care, HMSA's Akamai Advantage, Kaiser Senior Advantage, Humana, Ohana, and United Healthcare. Most of them offer a 0 premium plan. So I don't pay anything additional besides my Medicare Part B premium. And those are great plans for healthy people, because I've got that coverage just in case, but I'm not paying anything extra for it. And then for other people, we'll ask them, have you been in the hospital in the last year? Have you used the ambulance? Because then they might want to get a plan that's a little more comprehensive so that they pay the least money out of pocket that they can. And then we always screen everybody to see if they qualify for help paying for any of the Medicare costs. The Affordable Care Act has actually strengthened Medicare. It's done a couple things. One of the things is there's this famous thing called, well, Medicare calls it the coverage gap. We all call it the donut hole. It's a big puka where the drugs aren't covered. The Affordable Care Act is shrinking the donut hole, so by 2020, there will no longer be a donut hole, it will be continuous coverage. The other thing was that Medicare does preventive benefits, trying to keep people healthy and out of the hospital, basically. And they started looking at the data and realized people weren't using those preventive benefits, and they started to question why, and they realized that on some of them there was a 20% copay. So what the Affordable Care Act did was it took that copay away, so many preventive benefits, there's no copay to them. So it's to encourage people to get those tests early. So we have original Medicare, traditional Medicare, which is hospital coverage and doctor's visits and labs and x-rays. In 2006, drug coverage came into the play. So now we kind of have a comprehensive program. There's still gaps, and what the gaps are is your copays. Under original or traditional Medicare, it's usually a 20% copay. So when people are first eligible for Medicare, they can look at, how do I want to receive my services? Do I want to go with original Medicare and pick up what they call a Medigap policy or Medicare supplement, which picks up all that 20%. So the benefits are regulated by the federal government, the premiums are not. So this year in Hawaii, we have 8 companies that are licensed to sell Medigap policies. So that's one way I can do it. I have my original Medicare, I pick up a Medigap policy, and I pick up a drug plan, a Part D plan. Or I can choose the other route where I go through one of the local programs, HMSA, Kaiser, Ohana, and those are called Medicare Advantage plans. So with those plans, I'm signing my Medicare benefits to the plan, so they're taking care of everything. It's managed care. And so people have different options. So again, it's what do they feel is going to work best for them. So long-term care is anytime a person needs, they have activities of daily living that are impaired and they need assistance. Medicare is very limited. We don't want people to think that Medicare is a long-term care insurance program, to think that, okay, well, I've got Medicare, it'll take care of my long-term care needs, because it doesn't. It's very specific. Medicare will take care of skilled nursing care. So that means I would need the daily involvement of a licensed personnel. And so that's it's a challenge that we have. And so, and some people think Medicaid, our state assistance program, is going to pay. Well, you have to qualify for that program. It's an assistance program. So we just want folks to start thinking early, and it's best to start thinking in your 50s and 60s of, how do I want to spend my last days? How do I want to, do I want to go into a nursing home, or do I want to look at a long-term care insurance program where I can stay in my home? But, that coverage, that coverage is something that people need to kind of think about. And they can look at family history, they can look at their family dynamics, what's available. But those are one of the things we kind of walk people through. With long-term care insurance, the earlier you buy it, it's usually less expensive. And usually we always say, insurance is like car insurance. You don't buy it hoping to get in an accident, you buy it if you get in an accident. And usually you don't buy car insurance after you get in an accident. So that's why you want to look at it early, where it's still affordable. And there's a lot of different options with long-term care insurance now. They have, they've got programs for couples, they've got programs that can turn into a life insurance policy. So that's, again, it's one of those things that sometimes in our 40s and 50s we think we're never going to die, but we're all going to eventually need some kind of care, so we need to start looking at it early. The SagePLUS program, Hawaii SHIP, we're available to do presentations. So if you've got a community group that you wanted information on any type of the aspects of Medicare, we can come out and do presentations. And just sometimes it may not affect you, but you may have a family member or someone you go to church with that's saying, I just can't afford to pay for my prescription drugs anymore. Let us know, because we can screen them to see if they qualify for that help, and we can help them do the application. So it's really, just kind of taking care of the ohana, making sure that we're all just taking care of each other, and don't be afraid to ask questions, because some people will say, well, I didn't want to call because that's just a dumb question. There are no dumb questions. Just call us. One of the things I think that the Affordable Care Act did and the Hawaii Health Connector did was it's really helped our Medicaid program by we have a new system to do applications online. The federal guidelines say that they have, if I turn in a paper application, they have 45 days to look at the application. With these online applications, many times people are getting responses within 5 to 10 days saying, you qualify for help. So the one great thing about Hawaii is that we're a small state and everybody works well together. So we work with the connector people, we'll refer people to them, they'll refer people to us. So that's one really benefit that we have that many of the larger states don't have. And it's important for everybody to have health insurance, because we just, we don't want people to end up in the hospital with no health insurance, because the cost can just be, it can take away everything you have.
Waialae, Kailua, Royal Sunset, and Kapi'olani were all names of what? The answer is drive-in movie theaters. There you have it. Remember when we thought the future would be like the Jetsons? Well, it hasn't turned out exactly like that. It's better. The future is now, because the technology exists not to make life easier, but to maintain independence. I'm Brickwood Galateria. Join me next week for another episode of Kupuna Power. Aloha.